In our brief conversation, we're talking mostly about your experience and treatment decisions for you and how you're using a PARP inhibitor for the treatment of recurrent ovarian cancer. But the other exciting part about these drugs is that many of them are being evaluated in the frontline setting. So we could even move these up.
Well, that's good. That's
Right.
really good news.
So one of the things you told me is that this is the best you've ever felt in 4 years. So can you imagine at some point in your life being able to bypass some of those chemotherapies and just jump right to a PARP inhibitor?
Just jump to a PARP inhibitor. That would have been great if I was able to do that.
So there's a variety of combinations being evaluated. When you recurred, these studies weren't available, but there's at least 2 studies that I know of that are evaluating olaparib in combination with other therapies in large clinical trials. And they're comparing to standard of care chemotherapy. And so in both of these studies, it's olaparib plus cediranib. Cediranib's like bevacizumab, but a little bit different.
Okay.
It's an anti-angiogenic agent, but it's a tyrosine kinase inhibitor. It has a little different side effect profile than bevacizumab. But when they combine these drugs together, they showed this tremendous improvement in disease control, specifically in women who didn't have the mutation. So if you have a mutation, who knows, it may be that the PARP inhibitor is enough. But if you don't have the mutation, by adding it with these other drugs, you can harness more of the PARP inhibitor activity or synergistic way that it works with the other drug you're adding. So that's one combination they're evaluating now. And the results of those studies may change when and how we can use these drugs sooner. There's studies of the other PARP inhibitors in combination with either anti-androgenic agents or with immunotherapy agents. So immunotherapy agents we haven't talked about too much, but these are immuno-oncology drugs. The most common drugs being used right now are checkpoint inhibitors. Your immune system's trying to fight the cancer, but the cancer is finding ways to hide from it. And one of the ways it does is actually trick the immune cells into not recognizing them.
Great.
So some of these new drugs called checkpoint inhibitors prevent the tumor cell from doing that and really harnesses your own immune system to work with it. So there's some thoughts that if you add a PARP inhibitor with an immune therapy, you can have a synergistic effect. So it gives, there's a lot of detailed diving into the science about how that happens. So that's also on the forefront. And then who knows, at some point, we may find that we have an indication for PARP inhibitor maintenance in the frontline setting. SOLO-1's a trial that's been completed in the frontline setting, and there's other studies that are currently underway. So a lot of exciting opportunities in the future, either moving PARPs up, adding PARP inhibitors with other drugs so that you can get that benefit for all patients with ovarian cancer.